If you get headaches from time to time, you know that they're, well, a headache. While most of us experience common headache types, like migraine headaches, tension headaches, or even brain freeze headaches, there are more types of headaches than you might expect.
There are at least 150 or 200 different types of headaches.
Dr. Natalia Murinova is the director of the UW Medicine Headache Clinic. She and her colleagues see a wide range of headache types at the clinic. But because more common or mild headaches are usually treated by primary care doctors, the headache specialists get to see the more rare and extreme types of headaches.
One of the most fascinating headache disorders is cluster headache. There are headaches that occur only during certain seasons. They usually cluster during spring or fall, and it clusters during certain time of the day, like only at night. And so you'll have a person who doesn't have any headaches at all until the spring comes, and then they have very debilitating short headaches that, let's say, wake them up at night.
These are headaches that last 15 minutes to 3 hours in duration untreated, and they're very severe. Typically, the individual is in extraordinary pain.
People also feel extremely restless. This is one of the few headaches where people cannot stay in bed. And it can come like that for 6 weeks or sometimes longer. And during the 6 weeks, they live with very debilitating pain.
When someone has a cluster headache, they have a searing pain behind the eye on one side of their face. Interestingly, this side of the face experiences other symptoms as well.
It's a very bizarre type of headache because you'll look at the person and they'll have significant tearing of the eye only on one side of their face, and they'll have nasal congestion only on one side. They sometimes can have facial sweating. Sometimes they can even have changes in their pupil where the pupil can become small. Sometimes they can have an eyelid droop where it looks like they had a stroke. It can be a very scary sensation if a person never had that before. Cluster headache is more common in men. We're seeing it in women as well, but it's still men predominant. So one of the few pain conditions that affects men more than women.
Researchers are still uncovering the exact causes and triggers of cluster headaches.
There's a lot of new information. There is something called a clock gene. So in our brain, we have a center, like a brain clock, and this clock is very sensitive to changes in the environment, to changes in the levels of melatonin. So when we have low levels of melatonin with changes in season, the people who are sensitive to this will start having cluster headaches.
Doctors also know that cluster headache symptoms are linked to a part of the brain called the hypothalamus.
Hypothalamus is part of the brain that has to do with sleep, nutrition, hydration, and this part of the brain starts hyperfiring on the same side you develop the headache.
This causes those strange symptoms on only one side of the face. But the extreme pain that comes with cluster headaches is caused by the activation of something called the trigeminal nerve.
The trigeminal nerve is the only nerve that can cause pain in the head. So it's a common shared nerve that causes all the severe headaches.
The degree of activation of this nerve is what sets cluster headaches truly apart. This pain can be so intense, it can cause extreme distress.
It can be an incredibly terrifying experience to have such a severe headache. It also can be terrifying that it can recur over the course of the night and seem like it's become a new normal.
Sometimes people do not want to exist anymore because it's so debilitating.
They may not have a history of anxiety or depression, but in that moment, while the headache is ongoing, they can feel suicidal. And then after the headaches resolve, they can feel much better and back to normal. And so it's important for patients to know that there are treatments out there for this headache.
In fact, some treatments for cluster headaches are surprisingly simple, although they need to be done with medical supervision.
Cluster headaches can be treated with oxygen. If you put that 100% non-rebreather mask on patients with cluster headaches, the headaches completely stop within seconds or minutes.
Another remedy?
Taking high-dose melatonin. 10 to 20 milligrams of melatonin 30 minutes prior to sleep. Many people improve dramatically because we think that why the headaches occur in the first place because there's some dysregulation that has to do with melatonin.
There are more specialized treatments too.
There are new medications such as galcanezumab, which is a monoclonal antibody. It would be a shot once a month. Other options include GammaCore. This is a neuromodulation device that a person would put onto their neck, and that provides a signal that actually can improve autonomic nervous system function and can actually treat the headache.
A diagnosis of a cluster headache is the first step towards getting treatment.
So you need to have the correct diagnosis before you just start treating with melatonin or oxygen, because cluster headache can mimic many different types of other headaches, but also secondary headaches like brain tumor can present as cluster headache.
Dealing with this headache is hard, but there are more treatment options now than ever before.
What's tough about headaches is that other people can't necessarily see that pain, and they may not understand why is this person not able to participate fully in their usual daily activities. And so that can be extremely hard for the individual who has headache to not feel understood. I think that the most important thing to know is that there are treatments that are available even just in the last 5 or 6 years. So many new treatments have come out, and patients day in and day out tell us how much better their function is and how much better they are able to be with their families, do their jobs, and everything else they want to do in life.